There are 16,517 confirmed cases of coronavirus in Victoria in aggregate. That's 303 new cases since our last update yesterday. I'm sad to say that there are now 293 deaths due to coronavirus, 293. That is an increase of 4 since yesterday's report. Of course, our thoughts and best wishes are with the families of each of those 4 Victorians. This will be an incredibly difficult time for them, and we send our best wishes and our support and our condolences to them. Those 4 individuals include 1 female in her 80s, 2 males in their 80s, and 1 female in her 90s. 2 of those 4 deaths are connected with aged care outbreaks. There are 661 Victorians in hospital. 41 of those are receiving intensive care, and 28 of those 41 are on a ventilator. A total of 1,937,736 test results have been received since the beginning of the year, which is an increase of 23,262 since yesterday. Again, can I thank all of those Victorians who are coming forward, even with the mildest of symptoms, to get tested. Can I also, on behalf of all Victorians, thank our laboratory technicians, the very large number of people who are running our test sites. It's incredibly important work, and thanks to that team. But most of all, thank you to every Victorian who's coming forward and getting tested. Without those test results, we obviously don't know where the virus is, and we can't put strategies around it to contain it and drive those numbers down. So please, no matter where you are in Victoria, but can I send a special message to those in Bendigo, Ballarat and Geelong, and indeed right across regional Victoria and the state. If you have even mild symptoms, come forward, get tested. We've put extra staff on. We have more than 180 sites across the state. At almost 2 million tests, we are among the highest testing rate countries, if we were a country, anywhere in the world, and that is something that all Victorians should be proud of. But we've got to remain vigilant on that front, particularly in those big regional centres where numbers are low, but we have seen some increases in the last fortnight. That testing push only works if people come forward and get tested, even with the most minor of symptoms. There are 3,383 cases with an unknown source. That is an increase of 264 since yesterday. Now, Brett could speak to this in more detail, but just before people see that as a very, very big increase on previous days, we've always made the point, or at least tried to, that with that coronavirus detective work, it's not all done in one hit. It does take time to try and work out, try and exhaust all possible sources, and then to declare that case a mystery case. So they do come in batches, if you like. So I wouldn't read too much more into that than it's simply the product of multiple days' work being brought to book, as it were, being recorded in our numbers. There are 1,178 healthcare workers who are active cases, and I just again make the point to all Victorians, our health workers are getting this virus, and one of the ways that we can have more healthcare workers healthy and less getting this virus is to make sure that we all follow the rules. And I'm very, very proud, and I want to congratulate all those Victorians, I think a growing number of Victorians who are doing the right thing. But to anybody who is doing the wrong thing or contemplating making bad choices, if acting in your own self-interest or the interests of others in a broad sense isn't motivation enough, then avoid a fine. That always makes sense. But I think the ultimate motivation is to make sure that our health heroes are not put in more danger, they're not put in more difficult circumstances than they otherwise would be. That's a really powerful way that we can all say thank you to nurses and doctors, to AMBOs, to the whole hospital team. There are 2,938 active cases in aged care settings, and again let me thank all of those in aged care, particularly hospital nurses who, we've been asked to help. This is a Commonwealth-run system, but they've asked us to help, and we haven't hesitated. When I say we, it's not just people at our level, it's also literally hundreds and thousands of nurses who are in there doing amazing work in very, very confronting circumstances. I'm proud of them, and I thank them on behalf of all Victorians. There are 7,875 active cases across the state. The metro regional split There are always a few cases that are still being investigated, so these numbers won't quite tally, but essentially we have just under 7,200 cases, active cases in stage 4 areas, so Metro Melbourne, and around 484 in fact, cases in regional local government areas that are under stage 3. So those regional numbers are actually down on where they were 4 or 5 days ago. We're up, I think we peaked at about 512 if memory serves correctly. They're relatively stable, but we have seen some growth in those bigger cities, and that's why people in those regions, those greater Bendigo, Geelong and Ballarat communities coming forward and getting tested is really very important. I just now might speak a little bit just in terms of aged care. I gave an update yesterday, the day before, in relation to a number of homes that we have essentially taken over. So public hospital nurses have gone in and personal care attendants have gone in and taken those facilities over. That's all about making sure residents get the very best care. I can't rule out that we will add to that list. It's based on need. If we're asked to step in, then that's exactly what we do. I don't have any further facilities to add to that list today, but I might just confirm for you that outbreaks since 1 January this year, there's 2,938, of which cases, that is, that are connected with aged care outbreaks since January 1, 2,938, and 2,041 of those are currently active. So whilst some stability has come to a number of these settings, this is still a very significant challenge for all of us, and that's why we're so grateful to all of those staff who aren't doing what they would normally do. They are going in where the need is most acute, and they are doing us proud. I am very grateful to all of them. The total number of aged care outbreaks, that is, not cases, is since 1 January is 149, of which 124 are currently active. A total number of deaths associated with aged care outbreaks is 184. And I think we have been able to reconcile those numbers with the Commonwealth. There was a few different issues about how we classified different cases, but I believe we've come to a landing and agreed a settled number. If that changes, though, I'm happy to keep you updated. In terms of active cases, a bit of a breakdown there. 2,041, as I said, are active. 5 of those are in public aged care. 2,036 are in private aged care. Active outbreaks, 124 of those, of which 5 are in public aged care. 2 of those outbreaks are co-located, so it's multiple sites, multiple facilities on the same site, essentially run by the same team. And 119 of those 124 outbreaks are in private sector aged care. Total number of aged care shifts carried out by public sector nurses, 1,862 shifts. So when you think about that, that is literally thousands and thousands of hours of work in some of the most challenging circumstances. And again, I don't think I can say it too many times. Thank you so much to all of those staff who really have stepped up and are doing the most important work. In disability, and then we'll. I've just got a couple of announcements to make, and then we'll give Brett a go. Disability services, as you know, are now delivered through the Commonwealth-led National Disability Insurance Scheme. I think that's well understood. Still, we've been working very closely with the National Disability Insurance Agency, so the Commonwealth basically, as one single response. That's certainly our aim. That's what we want to do, to ensure safety and well-being of clients, but also staff, particularly in supported to those supported accommodation facilities. To supplement the role of the Commonwealth and the NDIS Quality and Safeguards Commission, our government has stood up a dedicated disability rapid response outbreak unit. So we think that's the appropriate way to go. There is some division of responsibility here, whether it be the distribution of PPE, but ultimately this isn't about who runs the system. I think that's very clear. But the need is one that will only be met by everybody working together, and that's what we remain exclusively focused on. That's all about appropriate arrangements for infection prevention and control, additional PPE, in-home testing, and making sure that we're keeping a very close eye on monitoring the health status and therefore the potential virus status of residents and clients and indeed staff. Just a couple of numbers to give you a sense of where that sector is up to. Total active cases across disability, 89, of which 24 are in transfer services, so services that are currently transitioning out of out of our management into the NDIS, 64 in already NDIS-run facilities, and one of which is in a state-funded facility that I believe will remain a state-run facility under some other policy settings that we have announced over time. Total sites 51, of which 15 are transfer sites, 35 are NDS sites, and of course one is state-funded. And the total resident cases 22, total staff cases 67. So that is an area of concern to us, but there is an increased focus on making sure that we provide the very best care and the best framework for staff, but most importantly for clients and residents. Just finally, before I hand over to the Chief Health Officer to speak about the epidemiology of the day, Victorians would be well aware, because there was such a huge take-up of the Victoria Together program. So this is a series of online platforms, everything from activities for kids, live music, comedy, all sorts of different free programming. It was very successful in the first wave. It has, to a certain extent, elements of it have endured, but I'm today announcing that it will be continued, relaunched in effect. Others won't mind if I do this, but if I can give Michael Godinsky and the Mushroom Group a shout out, some of the content they've brought to us has just been first class, and I want to direct Victorians, particularly given that we are the live music capital of our nation. That's on pause at the moment, but our undisputed leadership in that field should not go unnoticed. I want to direct Victorians particularly to the State of Music Introducing series. So Introducing showcases unsigned Victorian artists. They'll be introduced by an established performer, and the highlight of the first episode is Paul Kelly, one of our very best, setting the scene for singer-songwriter Jess Hitchcock. That'll premiere at 7:30 p.m. on Friday next week. That's just one example of a whole lot of content that we're trying to bring to people, acknowledging that it's not easy to be stuck at home. This is free content, it's first-class content, and hopefully it does play that part in keeping Victoria together and giving us just a little bit of support along the way in what are particularly challenging times. I might now ask the Chief Health Officer to make some comments, and then we're happy to take any questions you have.
Thanks, Premier. Certainly we're seeing some stabilisation in numbers overall. The number of active cases now in Victoria seems to have stabilised. The number of new cases, as I've said, is trending down. As I always reinforce, no room for complacency. But I do think it's important that people understand that the actions that they've taken, especially in recent weeks, are showing up in our numbers now. And so people should have hope and confidence that the things that we know work are now manifesting in our daily counts. Our new outbreaks every day are in single figures now. At one point in time, there were 20 or 30 new outbreaks every day. We're at 4 or 5 now each day, which is another positive sign. The number of active cases in aged care is beginning to stabilise. It's still far, far, far too much at 2,000. The number of active cases amongst healthcare workers is stabilising. It is also far, far too much. And so it's not to say that we're not going to continue to work extremely hard on addressing these challenging settings, but that we are seeing the benefits of what everyone is doing in the community, in wearing masks, in getting tested, in isolating when they have the very first symptoms, and in complying with isolation and quarantine when contacted by the department. But our efforts absolutely now have to focus on those tricky settings where transmission is hard to control, those essential workplaces that we know need to continue with their critical functions. Clearly they've been pared back in terms of the level of activity where that's been possible, but in aged care, in healthcare, in disability services, we need to work on all of the things that we can try to do to try and minimise transmission. Of course, that's a focus on personal protective equipment, but it's also a focus on making sure that no one turns up to work with any symptoms whatsoever, and that people are continuing to physically distance to the fullest extent they can in the workplace. It may be that people are focused on risk when they're dealing with patients or residents, or they're in their carer roles. but they absolutely have to be mindful of the fact that transmission can occur between friends, between colleagues, including before symptoms begin. That is not where all transmission is occurring, but it is where some transmission is occurring. So we have to work on each and every single aspect of transmission in those areas. But we are seeing the fruits of a very difficult period of restrictions, stage 3 and stage 4, and it should continue to trend down. Our effective reproduction number, so the average number of people that one person infects, is almost certainly below 1 now. It can get to 0.4, 0.5 if everyone can do the right thing. That's where it probably headed to in April, when we're in another very substantial lockdown and we saw numbers drop very dramatically. If we can get to an effective reproduction number at a similar level, we should see a similar reduction over time. So that is encouraging.
Going to take any questions you have?
Premier, I know you haven't touched yet on enforcement, but we have had some reports at 9 News of a luxury handbag company making home visits to well-heeled consumers. Is this permitted?
No. Online trade would be permitted, but there are some rules around that in terms of any staff presence that was necessary to facilitate pick and pack and sending those goods off. But no one should be going into any homes regardless of, as you say, how well-heeled the client might be or how luxury the goods might be. It doesn't matter what you're selling or what price you're paying. This virus does not discriminate. I'm more than happy to refer that matter to Victoria Police and they can have a close look at that, because that should not be going on. If indeed it is, that should not be going on. You just can't be having people into your home unless it's absolutely necessary. So, for instance, you can have a plumber come to your house if you've got a pipe that's burst. You can have an electrician come if there's some urgent issue with wiring or something of that nature. But there's nothing urgent about a luxury handbag. So I hope that's cleared that up, but we'll certainly send that to Victoria Police. I just want to say as well, look, we will see, and we have seen, some cases where people are making really bad choices, but I don't want that to take away from the fact that I think, and the data's beginning to tell us, that a growing number of Victorians are doing the right thing. And that speaks to the fact that people are taking this seriously, and I'm really hopeful about where we find ourselves right now. Now, I'll leave it to the Chief Health Officer to make analysis and to make judgments about corners and whether we've turned and all those sorts of things. The data's what drives me, and I won't make those predictions. But what I would say, I think we're seeing the best of Victoria at the moment. We're seeing the best of Victorians. We are staying apart, but we're unified, we're strong, we're looking out for each other. We're going to beat this thing. We are going to beat this thing, but we have to do it together. And that's why every time a poor choice is made, even one that you might think really only affects you, it doesn't. Because it can lead, just one bad choice can lead to one infection that then can potentially mean hundreds of people get this virus, and that many of those potentially finish up gravely ill in hospital. That's no good for them, it's no good for the heroes that are caring for them, and it's certainly no good for this strategy to get us to the other side.
Is current modelling predicting a return to stage 2 restrictions as early as December, as reported in the papers today?
Yeah, I've seen those reports, and I'm not critical of those reports. I think that you can try and extrapolate out about what months ahead look like. I've not done that because I just think it's too far away for us to have the clarity that we would need to make those sort of predictions. But there'll be a number of different options. That may well be one of them, but it'll depend on how hard we all work right now to get to that point. So it's literally one day at a time, everyone doing the right thing. But yes, of course, doing it tough, we know that. But this period, this intense period of quite some pain, but there will be enormous gain to get beyond this health problem, to get beyond this second wave. And as I said yesterday, and I will make the point again, we've got to do this right. Otherwise, if we let our frustration get the better of us, and we kind of pretend that the second wave's over when it really isn't, and open up when there's too many cases out there, then all we're really doing is we're just kicking off a third wave and potentially a fourth. That's not what we want to do. We need to defeat this as best we can. That's not easy, but it will be much more likely if we all keep making good decisions. And if we just let our inherent strength shine, if we just let the fact that Victoria is a place where people look out for each other, where we are strong. There's a lot of pain out there, a lot of people are doing it tough, but I'm so proud to say that there's so many people looking out for each other. All sorts of acts of kindness and support. It makes you proud. We'll get to the other side of this, we will, but for my judgment, it's too early for us to be making predictions about when that is.
What does your modelling show?
Oh, well, there's no modelling that goes out until the end of the year. There'll be modelling that talks about and tries to speculate, and that's all modelling is, that this stage 4 over the 6-week period will be successful. That's what the modelling shows. But again, a lot of that is based on, and I'll put it to you this way, Paul, I think the modelling gets better every day that you've got actual stage 4 data. So I know that's frustrating because it means you've got to get well into it before you know when it's going to end. But if you think about it, it just makes sense. You've got theoretical data, so what we think we should be seeing, versus the actuals, and the more of those actuals we get, the clearer the picture. So these numbers have, if you look at a 7, 8, 10-day average, they are coming down. But I'm incredibly cautious not to have anyone, not even one Victorian, come to the conclusion that this is somehow, we're on the run now and we can just let it all unfold. No, we've got to keep working hard every day in the choices that we make, because it's not a sprint. This is an endurance race. It's an ultra marathon, at least. It might even be more than that. But the signs. This is much better, of course, than having numbers at a much higher level.
When did you last have a day off?
Oh, I couldn't tell you. I don't know. I don't stop because this virus doesn't stop, and it's not just me though. It's a team of thousands, and thousands and thousands of people who have never worked harder, and I'm very proud of them. Very, very proud of them. And indeed, Victorians are doing the same thing.
And you're our leader. We want you to be strong. You feeling as strong as ever despite no day off?
No, I've always said this is not, this is the job I signed up for. There's no easy days in this job. It's a great honour and a privilege to lead this great state, but no one said it'd be easy. So you just got to push on, push through, and get the job done. That's what I'm focused on. And I'm very grateful to my team around me, and the most important members of that team are Kath and the kids, and they look after me, and I'm very grateful for that. But we've got a job to do here, and it's not about days off. It's not about that. It's about getting the job done. And we will beat this wicked thing, but we can't do it on our own. We need every Victorian to work with us, to work with me and my team, to make the right choices. So everything, any symptoms, get tested. Stay at home till you get your result. Follow the rules. That's how we'll get to the other side of this quicker, and that's how we'll save lives.
Your Health Minister, Jenny Mikakos, categorises herself as unlucky to be Health Minister at this time. What's your response to that?
Oh, look, this has been a pretty difficult year for all of us, whether it's bushfires, and when I say that, I'm not talking about us, I'm talking about families that lost everything. Coronavirus, we've got families today that are planning funerals. We've got teams of people, thousands and thousands. I had a long Zoom meeting with a group of nurses the other night, and one of whom has got the virus, and even nearly 4 weeks after she first got her positive test result, she's still very, very unwell. Her partner's got it as well, so she's not well either. They're the people I'm focused on. I'll leave other people to make judgments about how the year's unfolded. This is what we've confronted with, and you don't get the choice to do anything other than push on, and that's exactly what the Health Minister's doing, and every minister and the teams they lead, which are it's thousands of people. It really is.
She's unlucky?
Oh, look, I'm not going to be a commentator on her commentary. This is a very challenging year. It's a very challenging year. But the point I want to make, we are equal to this. Victorians are equal to this challenge. It's not easy. This has been thrown up. This is something that we've got to fight together. And I'm hopeful. In fact, I'm certain that we will beat this. But we'll do it quicker and we'll do it better if everybody works together with us to get that job done. And that's what we're all focused on.
Premier, there's 184 deaths connected to aged care homes, and that's
Yes.
a figure that your government and the Commonwealth agree on. So why was it...
I believe so, yes.
Okay, so why was it that Victoria's numbers, they were lower than the Commonwealth's?
I think there's a whole range of issues, and I'm happy to get you some more detail because now that it's been resolved, I can't give you literally a line by line, but I think there were some reporting issues, birth, deaths and marriages data versus some things that are notified to the Commonwealth versus, for instance, someone who might have been in an aged care facility, then come into a hospital, and then they might have been there for quite some time and they've passed away in hospital, so which environment do you kind of attribute it to? So the total numbers of people who had died were accurate. There was no problem there. It was just about trying to reconcile slightly different data sets that we have and the Commonwealth have, and in fact, again, it's been resolved. But I will make the point. Through our discussions with the Commonwealth, we were telling them about numbers that they hadn't included. So their numbers weren't right, neither were ours. But that's just the way these things are. We've got different systems, so we've been able to reconcile that. It's not impossible that there are further challenges with that as we go forward, because everyone's unique, every circumstance is unique, but I'm confident that we've got that sorted. I'm happy to go and double check that for you, and if there's any other examples of what might have led to those differing tallies, I'm more than happy to provide them.
Regarding aged care, there's reports of some horrific reports, including some of a patient or resident who had ants crawling out of a bandage. Are you aware of that?
Yeah, I haven't seen the footage. I have been briefed on it though. That's just shameful and will be very distressing for everybody concerned. I want to be careful not to be critical of any provider, but I think that footage relates to a particular facility which we have now taken over. So I would hope that any of those issues would be dealt with quickly. I get an update most nights on where aged care is up to, kind of a sit rep across the whole state. I'm more than happy to follow that up with my senior officials. But there are a number of these facilities that public nurses, so hospital nurses, have gone and taken over, and I think they've taken over for good reason. It doesn't serve any purpose though for me from this podium to kind of be a commentator on that system. I think the most important thing is we focus on the residents and their families, and we get to the other side of this and we provide the care and dignity that every single senior Victorian is fundamentally entitled to.
Do you have a figure, or is there a rough percentage on how many people of the 600 odd who are currently in hospital,
Yes.
how many of them are from aged care settings?
I don't, but the Chief Health Officer may.
Not exactly.
Why don't we?
The majority.
Yeah, it's certainly more than half. What we might try and do, let's include that in the Chief Health Officer's release that'll come out at 1:32, as it usually does.
Do you feel
From that, the Australasian College of Emergency Medicine today has raised concerns about too many aged care residents being in hospital but being in there too long, and that there's not a plan to move them back into aged care settings. Do you have any concerns?
Well, I've got
about
nothing
that?
but respect for the Australasian College of Emergency Medicine. I've worked very closely with them over my life in these sort of roles. But what I would just say is, you know, if we were to go back over the last week or so, you know, we've had some people say you're not putting enough aged care residents in hospital. We've had other people say now you've got too many in there. They're there for too long, they're not there for long enough. Look, what I'd say, everyone's entitled to their view, and I understand that people have different perspectives, and everyone, I think, is motivated by trying to get the best outcome, but I'm not going to put anyone that's in a hospital bed back into a private aged care bed unless I am 100% satisfied that that system can provide for them. I'm just not going to do that. Now, part of my challenge is that I'm not the only one that makes those sort of choices. It's got to be done because we don't run that system. But we try and work as closely in a partnership as we possibly can. And one of the compromises is, well, you know, for instance, if people have to go back because that's the decision that's made, then we have left some staff. So we've left hospital staff in there as a kind of blended team. Again, I don't mind getting criticised by that college. It comes from the best of places, I'm sure. We've got the same aim. But I would just respectfully say to them, I'm not going to have people going back into a private aged care where I think there's a doubt that they're going to get the care that they need. That I think is the right call.
Is the state working on, or should the state be working on a plan with the Commonwealth to
every day.
transition those aged care
Absolutely,
residents?
every single day, and I think we've even seen some commentary about some, whether it's St Basil's or others, where, you know, there's been a really significant crisis there, and a bit of criticism about the notion of that facility maybe taking residents back. I'm not making a commentary, I'm just saying there has been commentary. So look, there'll always be debates, there'll always be differences of opinion. I'm not so fussed about that. People are entitled to their view. We are all trying to get the same outcome here. We've been asked to help, we've been asked to step into a system that we don't run, and we are there doing it. But we've just got to be careful. We've just got to be very careful that we're not out of some sense that we've got to stand private aged care back up again where there's been really significant problems. My concerns are not for the sector or the businesses that run it. My concerns are for the residents and for their families.
Is it putting pressure
And that
on
is not
hospitals,
going to,
though?
that will not change.
Is it putting pressure on hospitals? Is there a capacity?
Look, there's pressure there, but we are creating capacity. We've had to make the very difficult decision, and I can tell you, it's very difficult when you've done more as a government, when we've done more elective surgery than any government in the history of this state. It hurts to cancel elective surgery, but we've had to do that except for the Category 1s and the most urgent Category 2s. That in itself, and some other things we've done, has created additional beds, additional capacity, because we need to make sure that those residents are getting the best care. That's what we're focused on, and there'll be a time to look at private aged care, and indeed that's actually happening now. You've got a Royal Commission happening, and I wouldn't offer any comment on that. That's an entirely separate process, and one that I'm sure will get on with their work.
We've had contact from several family members who are trying to get onto their parents in aged care, finding that very difficult.
Yeah, it's tough.
Hung up on, cannot get any contact with their loved ones. Does that surprise you?
Look, I've raised this matter with the Prime Minister directly, and it's not for me to speak for him, but I can tell you that he and I were both very motivated to try and improve this, but it is incredibly challenging. It's more challenging than I'd like it to be. I'll raise it with him again. I know he's onto it and he understands it. That was a couple of weeks ago now, but I would just say, I thank our health heroes a lot because I just think it's an important thing to do. But let me just explain some of the stuff they've been doing. So these are hospital nurses who normally would be on a medical surgical ward doing all sorts of other things, nothing to do with aged care. They then go into places of total crisis. We've had to increase counselling for these people because you can't unsee what you've seen. This stuff is very, very challenging. But they're not just doing clinical care. They're, for instance, taking iPads to people's bedside so that they can Zoom to their loved ones. They're running phones around to people. That is not their job, but they're doing it because that's the people they are. So we're doing our very best. I think us, as a system, us and the feds, I think we're working as hard as we can, but if there's reports to that end, I'll follow that up personally.
Does it surprise you?
Oh, look, I think that there's no criticism of them, but there are a lot of clerical staff who would otherwise do this work who aren't in there because they're furloughed because they might be close contacts. I'm not blaming them, it's just a fact. I think it's a very challenging environment, but anything I can do to speak with the Commonwealth about getting families information and clarity, I will follow that up, and I'll follow it up personally.
What's your message to those families who have been frustrated not being able to contact a loved one
I understand.
in such a vulnerable situation?
Yeah, sure.
You can't imagine the heartache.
No, I don't think you can. Unless you've been there, you probably can't imagine it. But to the extent that I can, I'll just say to those families, I understand this is a very, very difficult time. I'll do my very best to make sure that you're getting the information that you need. I'll speak to those who are responsible for that and try and improve that. But I would just say to those families, don't be in any doubt. The only thing that's driving me is the very best care for your loved one, and that will not change.
Are you concerned about restriction fatigue? For example, today it's a nice morning, and obviously a lot of people are going out and enjoying
I had hoped it was going to rain a lot, but
how are you grappling with that? How are you going to bring people along for the next?
For any interstate viewers who are tuning in today, the irony of us complaining about the weather. But anyway, that it's too good. I mean, look, I think people know and understand, as frustrating as this is, and yes, it's a beautiful morning, but we've got people this morning that are planning the funerals of their loved ones. So let's all keep the perspective that we have to keep. It's not over. The signs are encouraging, but it's not over. There's a long way to go, and the only thing that wins, if we get fatigued, if we were in any sense to give up, the only thing that wins is the coronavirus, and we just can't have that happen.
Any hope though? The current restrictions are due to end on September 13.
They are.
Are we on track to meet that at least?
Well, look, it's very difficult to predict. It is very difficult to predict. But what I am saying, what I want to be clear today, I'm proud of Victorians. I want to congratulate, I think, a growing number of Victorians, up into the 90%. That's how many people I think are doing the right thing. There are some who aren't. And one of the real wicked features of this thing is that it only takes one person or a handful of people to do the wrong thing, and it can undermine everything. But I'm proud of Victorians. I congratulate them. I am hopeful about these numbers. But again, they can change quickly because this thing moves so fast. You can't see it. It doesn't discriminate. You've got that wicked problem where you can have it and not know, and you can be at the height of your infectivity before you get your symptoms, or when you've got very mild symptoms. That's why any symptoms at all, only thing to do, come and get tested, then stay at home while you wait for your results. Hopefully you are negative. But every single person who does that is making a massive contribution to all of us, not just them and their family, but their community, their state, getting to the other side of this.
I know it's one day at a time, but how confident are you that next year will be any different to this year?
Well, if we are able to defeat this thing, that is to say, get the numbers down so low that we can, with confidence, never certainty, because that's not you look at New Zealand, there's no certainties in this, but we have greater confidence that we can keep this contained, then 2021 should be different. But I think we've had this discussion before, but 2021 will not be a normal year. It'll be, at best, a COVID normal year. Unless, of course, a vaccine can be developed, produced and administered, which I don't think is going to be happening, all three of those things, inside a year. I genuinely hope to be proven wrong in that, but that seems to be, despite very promising signs, that could be a long way off. So it's not normal that we're looking for. It's a COVID normal, and at the moment we just can't find that place, because if we tried to, we could declare victory, and isn't it great the second wave's over because cases are under 400? All we'd be doing then is just sitting back waiting for the third wave to happen. And I think that would do, well, obviously even more damage, and that wouldn't be weeks or months, that'll be a year. That'll mean you've just lost control completely.
On a clear day like this, ordinarily, there'd be thousands at auctions.
Yep.
That's not happening.
Correct.
You're not getting stamp duty. How
Yep.
significant is that not being on the balance sheet?
Well, look, we'll bring to book in the budget later in the year all of our revenue, and there's no question the update that the Treasurer's provided this week shows that there's been a massive hit to revenue. At the same time, there's been a very significant impost we've had to spend, because there's no choice but to try and provide as much assistance as you can, plus ventilators, masks and gloves, all the other things that we need to do. This is a 1 in 100 year event, and you're going to see the federal budget, our budget, every budget around the country is going to look very different than it's ever looked. My focus, though, can I say, is on household budgets, and the best thing you can do for that is to create jobs. And you'll see us, once we beat this thing and once we get to the other side of this second wave, our exclusive focus will be on skills and jobs, and making sure that we support families, individuals, and that through them the economy, to repair the damage that this wicked enemy has done.
Would you consider reclassifying real estate to be an essential service?
No, look, the Chief Health Officer's made it pretty clear that we've got to drive down movement, and I know that I know it's very, very difficult and it's frustrating. I've tried to make this point a few times now. I get a lot of people come to me with very well argued cases. And it's not just businesses who are concerned about their profits, they're businesses who are concerned about their people. And I get that. I absolutely get that. I grew up in a family, a small business family that was fortunate through hard work to have bigger businesses than, say, you might classify a small business. That was all through hard work. I know how heartbreaking it is to see years and years of toil just washed away. I get that. But we've got to fix this. Any benefit that might be there for a few weeks, that'll be washed away if this doesn't work, because then we'll have months of restrictions, many more months, and potentially even harder than stage 4. We don't want that. We've got to We've got to do this properly now so we can get to the other side of it.
Can I just ask Daniel Sutton a question about the R rate or the ref rate?
You absolutely can.
He can explain to...
I don't think he's been called worse than Daniel Sutton, but that's all right.
Oh, sorry. That's a journo in...
You didn't call him Dan Sutton, so it's all good.
Sorry,
Must have been
Brett.
someone else you were thinking of. It's all good.
Sorry. Brett Sutton.
Yes,
just
Professor.
Explain to the audience or our viewers and people watching online, can you give a simple explanation for them as to what the ref or the reproduction rate actually means?
Yeah, so the ref is a number that represents the average number of people that one infected person is infecting in a generation of transmission. It takes about 5 or 6 days on average for a generation of transmission. When that number is one person is on average infecting one other person. When this all started in Wuhan in China, the ref was estimated to be about 2.5. So without interventions in place, without people distancing, without isolation and quarantine, one person would infect 2.5. And that happens every generation. So every week it was between doubling and tripling. And that's why you get hundreds of thousands of cases within a couple of months. If you can get the ref below 1, then on average one person will infect 0.8. 2 people will only infect one person. The reality is most people don't infect anyone, but there's a small percentage, maybe 20 or 30%, who might infect dozens of people. So there are these super spreading events, and there are these settings, especially indoor settings, work settings, where people are in close contact, where you can have a great number of people infected. That's what cruise ships did. The restaurants in New South Wales had 100 cases plus. We know from our meatworks that you can get hundreds of cases. Germany had a meatworks where 1,500 people got infected. So there are settings that amplify that risk. But if on average we can get that ref number below 1, then every generation of transmission will see fewer and fewer cases over time. And that number is completely affected by what we do at a kind of community level, how much time we're spending at home, limiting the number of people that we might meet for essential reasons, but also at that micro distance. So whenever we're meeting someone, that we've got a mask on, that we're not shaking hands, that we're not hugging and kissing, and that we're not getting closer than 1.5 meters. So those overall actions of the number of interactions that we have with others, as well as how we're interacting with people when we have to, keeping our distance and not being there if we're unwell, will drive that ref number down, and we'll see cases continue to drop.
To deal with the issue of fatigue, are there markers that we should be looking for in the next few weeks to know that we're on the right track? So next week, should we see numbers in the 200s, and the week after that, should we see them in the 100s? If we're going to get to a potential easing of restrictions at the end of that 6-week period, are there markers people can follow to give them a sense of optimism that we're actually getting somewhere?
Absolutely. Look, the numbers will play out over the next couple of weeks. We'll be able to calculate that ref number over the next week or two. A couple of times a week we'll calculate that. If it's looking like it's getting to 0.6, then we're doing very well. If it's sitting at 0.8, that's too slow. That means that we're not doing enough. We do all of the data around transport. We know from people's mobile phones, again, publicly available data, how much time they're spending at home, how often they're asking for pedestrian directions, how often they're asking for driving directions, and we can get that mobility data at a population level, which tells us very much how restricted we've been in our activity. And it's looking like it's as good as it was in mid-April when we were at our very best previously. So that's encouraging. If it fatigues, we'll see that there's too much activity on the roads. There's too much time where people's mobile phones are outside of their residence, and there's too much activity that suggests that people are moving around. So they're the kind of data sets that we'll look at, as well as the numbers week on, week out that suggest that either we're driving numbers down with a ref of 0.5 or it's much, much closer to 1, in which case it'll be a very slow decline, and we won't get to even 200 cases at the end of 6 weeks.
So how useful is the other raw numbers each day? So if we say we had next week we're in the 300s all week. Is that a worry? Is that setting us back, or are there other factors that are more important?
There are a combination of factors. If we're in the 300s all of next week, that would be too slow for my liking. But we do have to bear in mind, where are those cases occurring? Do they relate to outbreaks? Will those outbreaks come under control in coming days or weeks? If it's mostly transmission in the community across all of Melbourne and all of Victoria, then that would be more concerning. If we know that those individual days that spike relate to an outbreak that we're getting on top of, then that's, I guess, it's a challenge for the time, but it's also one that we can have some confidence that we'll get on top of.
We're pretty much 2 weeks after stage 4 now, which is kind of this one life cycle. Has stage 4 had the effect you're expecting? Is it doing better than you're expecting?
Oh, it's really only in the early days of what you might see manifest with stage 4. So we really can't make a call on what today's numbers are in relation to those restrictions. We know that the mobility data is very encouraging, so we have an expectation that that'll continue to drive transmission down, but showing up in the numbers can take a bit longer. You've got that average incubation period of 5 or 6 days, getting tested, getting that result in, getting it notified to the department. So that can take 9 or 10 days from the time that someone's exposed. So we won't really see it show in the numbers until next week.
Have you become frustrated with individual employers? I presume when doing tracing and investigating clusters, you'd be familiar with particular employers. Are there any that have really come to you? You don't necessarily have to name them. But do you have concerns about people doing the wrong thing?
Look, there are very well constructed lists for shift work with some employers. It's been very encouraging. There are employers who've really done a terrific job of cohorting their staff to make sure that their AM and PM shifts don't cross over at all, to make sure that in a very big workforce area on the floor that they've also cohorted geographically, that they use separate toilets, or that they have well-spaced and separate tea rooms. So there are good employers in that regard, and there are employers who unfortunately have learnt the lesson too late, where we're asking them to quarantine dozens and dozens of staff because they've mixed very freely in large numbers, where they might have been able to cohort, they might have been able to separate better. If we hear that there's a workforce that have basically mingled across shifts and across work floors, then they're all close contacts, and they all have to be quarantined. So the lessons have been learnt over the last few weeks, there's no question, and I think WorkSafe are very focused on that from a compliance point of view. We've been focused on it with the public health directions that we've made to make sure that the policy focus is minimising those opportunities for transmission in the workplace as well.
Are there any that you've referred on to other agencies, or even referred on to the government for further action or
we do routinely let WorkSafe know. It'll be up to WorkSafe as to whether they think that there's a compliance issue that they need to follow up, or whether there's even a prosecution, but that wouldn't come back to us necessarily.
Our daily death number has been around 15 to 20 for the past week. Today 4. Is that a blip?
It probably is a blip. I think it's always pleasing not to have a day of 10 or 20 deaths. They're awful days. But the numbers will vary from day to day, and we know that with 2,000 infected residents and staff in aged care, a very vulnerable population, that we will see more deaths with those infections. And so, we basically need to see those numbers of confirmed cases in aged care and all settings come down before we can be confident that the deaths that occur as a result will also come down.
We've heard for months how important contract tracing is, and the thousands doing that. What are the trends that they are noticing when they are talking to all these thousands of contacts?
Look, there's a positive trend, there's a negative trend I'll tell you about. A positive trend is that the number of close contacts that confirmed cases have is coming down very substantially, and so you'd expect that. We speak to people, we ask how many close contacts they've had. A number of people say, I have no close contacts. Or they say, it's just my household contacts, so 1 or 2 close contacts. It's still concerning that people are also asked, have you isolated from the time that you develop symptoms. They might have isolated from the time they got their test result, that's great. But from the time they got symptoms, a lot of them are still not isolating at the time they get those very first symptoms. And again, just have to reinforce it. Doesn't matter how mild those symptoms are. Cough and cold symptoms, runny nose, sore throat, headache, fever, the beginnings of a cough, they're all signs of coronavirus. Change in smell, change in taste. You wouldn't necessarily expect that it's coronavirus. It can and will be coronavirus for a many number of people. So you have to isolate at those very first signs.
Is that trend going up, the people who are saying, since symptoms, I haven't isolated?
I don't know the trends over time. I think it's a pretty stubborn figure to move. We just have to keep at it. I think one of the critical things is isolating from the workplace, isolating from those settings where you can spread it to a great number of people. That's a really key intervention.
As our Chief Health Officer, what would be your advice to a man who has enormous responsibilities, is working under a lot of pressure, has done so for weeks without a break? What would your advice to him be?
I'm not here to advise the Premier on his work schedule.
I didn't name the Premier.
I did. Everyone needs to look after themselves in the long haul. I say to my team, I try and look after myself to the fullest extent possible. We have to be on our game every day. If the Premier wants me to stand up and do a presser on my own next Saturday, I'm more than happy to, so that we can look after each other.
Do you know how many of those 2,000 aged care cases are residents versus staff?
They're both very substantially. I think there are some aged care outbreaks where the majority are staff. There are a number where it's just one or two staff and a number of residents. But I don't know the breakdown amongst the 2,000. But it's hundreds in both categories.
Is it a given that if and when we finish stage 4 that we're going to go into stage 3, or is it possible we could skip 3 and?
Oh, wouldn't we all love to know? Look, it's really difficult to say. Again, you would have to see what the data is showing you, where the ongoing transmission is, as to where you might ease up. And it may be that we are easing in areas that we know are not contributing to transmission, because that's the least risky thing to ease up on. We would certainly always balance what are the benefits, psychological, health-wise, in terms of easing of restrictions. It's profoundly challenging to be on your own, for single-parent households, for people living on their own. Not being able to see others is a really significant thing. We've constrained those home visits because we know that transmission has occurred there. But I'm very mindful of the fact that that's a burden that everyone's carrying, and that some people will really struggle with. And so we'll always look to both where the risk of transmission is occurring, but also where the great benefit can be for people as we ease restrictions, both in terms of jobs and economic activity, obviously for Cabinet to consider, but also for their physical and psychological welfare.
How difficult is that though? Because I know that, for example, at the start of this kind of second wave, you were saying that those family gatherings is where a lot of transmission was happening. It wasn't necessarily in pubs and cafes and stuff. So I suppose how hard is it to manage that balance there and give people that hope? Yeah,
we will have to manage it, and it's a fine balancing act. But when New Zealand went to its very hard lockdown, they didn't even allow intimate partners to meet. I'm mindful of the fact that de facto relationships of people living apart are very significant for many people. I don't want people to game the public health directions to see whomever they wish, but I am mindful of the fact that that's an important relationship to support when it's genuine and a genuine intimate partner. But we may move to a point where we can say that you can have visitors at home, obviously. But we need to balance that against what that transmission risk is. I don't think we'll be jumping to 10 people in your home immediately. I think it'll be an incremental easing.
Are you able to elaborate just a little on how you're using mobile phone data? I knew about traffic and foot traffic in town, but how are you using that data?
All I know is that Google and Facebook data is publicly available. It gives geolocations for people's mobile phones, and it can basically show at a population level where those movements are occurring, how they rise and fall through hours of the day and days of the week, and we're seeing it at the lowest levels that we have since mid-April. Very substantially down 90% in the CBD, more than 60% across Melbourne, and that carries through all hours, especially post-curfew, as you'd expect.
Thank you.
De-identified,
Yes.
yeah. Population level data.
Yeah.
And Professor Sutton, so you're not concerned about the spike in mystery cases?
No, the mystery cases today, the increase in mystery cases is those investigations being closed off. So they're not attributable to today's numbers. They are the numbers that have been closed off that will relate to historical cases going back for some days and sometimes weeks when you're still investigating to make sure that you're not missing a link that links back to a cluster or a known outbreak or a known case.
How is it that we're still, I know it's not all from kind of yesterday or the day before, but people have been told to stay at home and things like that and not be mixing out in places of unknown transmission. How is it that we're still getting those high numbers, you think?
Well, transmission will still occur for those essential reasons that people need to be out and about. So we knew right through stage 3, even as it was beginning to work, that it was very slow to have an effect, and that did relate to people who had to work, especially casualised workforces, where they had real incentives to turn up to work with mild symptoms. And now there will be some transmission in workplaces because people are doing essential work, or these are permitted industries, and they will be hopefully mostly excluding themselves when they've got symptoms, but there will be some people who are exposed, turning up to work, and then developing symptoms at work, but they've already been infectious and therefore transmitting to others. So it's profoundly challenging. It doesn't just stop in a week when you close off a lot of the permissions that people have had to move around.
Can I make a couple of comments about just one family? It's not often that I would single out one family, but on behalf of all Victorians, can I thank the Din family for their honesty. That's a very, very moving piece today, and I want to thank them for telling their story. And if that doesn't motivate all of us to do the right thing, I just don't know what would. That family has been through a lot, and one of their number is still in intensive care, and we wish them well. I just wanted to make, I think Brett's answered the question on employers and some of their conduct. I don't want to add to that at this point. I think there's a broader point here, and I'll try and make it as clearly as I can. Insecure work is toxic. There is nothing good about insecure work. And when this is done, when this virus has been beaten, we all need to commit ourselves to do something really significant about it. It's no good for anything, for families, for a sense of security and safety and certainty, for public health, for any purpose. We've got a lot of people who work very hard but have no safety net to fall back on, and that's just not something that we should settle for. So that's one of many things that we'll, not for today, but we will need to come back to that. And we absolutely should.
Can I just ask, Alfred Health, who's looking over some or all of the quarantine hotels now, they're advertising casual...
The hot hotels, as they're known, so
Yep.
essentially hospitals, they are really.
Yep. They're advertising casual roles for security guards to work in those hotels to help out.
Yes.
Considering all the talk about security guards, are you comfortable with that, or would you prefer that Alfred Health, say, speaks with the government to find other solutions?
Let me come back to on exactly what roles they'll be filling. I think they're not to do with security as such. Corrections Victoria is running the security element of that program. It's a different program, of course, to return travellers, but I'm happy to follow that up. The hotel that the two of them actually that the Alfred are running. One that the Alfred's running, and I think one that another health service is running. It escapes me exactly who it is now. But they are essentially hospitals. They're campuses of that health setting. So that's not to say security is unimportant. It is very important. But let me come back to you on exactly what roles those people would be doing. And hopefully that gives you some clarity. But I'm confident they've got arrangements in place that are all about providing the best care in the most secure way. Not only looking after those people who need looking after, but also protecting all of us by doing nothing that would add to the amount of cases in the broader Victorian community.
We saw news today that this role of state controller was changed from the previous plan for it to be chief health officer to be other people. Can you just explain whose decision that was and why that?
Well, Kim Peake is the State Controller, and Crisis Council of Cabinet and Cabinet more broadly have agreed to that.
There's been several people that have done it.
Yeah, because this is a long, challenging, unique 1 in 100 year. I don't even think it's 1 in 100 years, frankly. This is unique when you think about all the different challenges that are presenting. I think you've got to be nimble. You've got to have a preparedness, not to be, a plan developed in 2015. It's not a stone tablet. Like, it needs to change if circumstances change, and this is different to, it was put to me yesterday. 2009. You said certain things were said, certain things were agreed as foundational principles. Yeah, and how long ago does that seem? Like 2015, that's a long, long time ago.
So what was the logic at the start for the chief health officer never to fill that role?
Well, I think, hang on a minute though, I think what you've got is an updated pandemic plan that we released on March 10 at the Royal Melbourne Hospital. In that, what I assume now is an ICU ward that was empty then, it's full now. We always knew, and I think at that very press conference, probably more than ever, I had the attention of all of you guys because I started to talk in pretty frank terms about what was headed our way. So there's always been an acknowledgement that a big team would be needed and that arrangements might need to change. I just think the criticisms of the arrangements we've got in place are wrong, and they completely misunderstand the challenge that we're facing. And Brett didn't provide advice on my what I ought to do, so I won't provide him with advice either. But I would just say anyone who thinks the Chief Health Officer is not absolutely at the centre of this would just be wrong, completely and utterly wrong. He may wish he weren't for a day or two, but he is at the centre of this, and any suggestion that he's not is just wrong. I'll go back to the other point. Andrew Crisp is not a firefighter, but he ran the bushfire response. You do what you need to do to get the best outcome, and that's exactly what these structures are all about.
Can I just ask a quick one about something that we used to do, and that's called go to the footy?
Yes.
If the grand final is played interstate, will Victoria still have a public holiday?
Well, it'll still be the Friday before the grand final, so I'd say yes. I reckon Victorians may well have earned that. They may well have earned that, and if there's a bunch of people who want to criticise me for that, go do it. Fine. If that makes you feel better, fine. But this has been a really very, very difficult year. What October looks like, none of us can say. But I'm pretty certain that if we don't see this through, then it'll be worse in October, not better. But I'm hopeful that we will. I'm hopeful that we will see this through. That public holiday is, we made a commitment. It's not universally popular, but we made the commitment. We honour our commitments. That day's there, and I've got no plans to change that, no matter where the grand final is played. And if some in the business community want to have a crack at me today, if that makes them feel better, then fine. But this is it's about working to live, not living to work, perhaps. I think I've made that point a few times. It's a special day, and we should try as best we can in this year of challenges to make it the most special day possible.
Thank you.
Any other questions? If not, we'll see you tomorrow.
Thank you.